Hello. Thank you so much for joining me here today. My name is Melody. I am a yoga instructor in Texas, and I just wanted to create this video to share with you something that has really helped me a lot personally, not only through my yoga practice, but also in my day-to-day life. And this is a little bit of physical training and therapy that will help you alleviate any pain you might be having in your SI joint or through your sciatic nerve. So if you're like me and you've got a little bit of discomfort and maybe a little bit of dysfunction in that sacroiliac joint, which is in your sacrum in the back of your pelvis, and that joint dysfunction or misalignment might be causing some pain through your sciatic nerve. So if you don't know at all what I'm talking about, you might be experiencing some pinches or pulls in the top of your glutes, of your cheeks, normally on one side more than the other, and then sometimes when that sciatic nerve is compressed, it can cause pain or discomfort down your leg and through your thighs. So this is just a little bit of work that I have used in my own practice and my own body to help me alleviate some of that discomfort. And we're going to be focusing on our adductors and our abductors, which are the muscle groups at your inner and outer thighs. We're going to be strengthening those muscle groups so that we can strengthen the support system around your sacrum and around your pelvis and help keep those joints and those bones in place. So to help us out today, we're going to need a couple props. And the first thing you're going to need is either a yoga block or a bar ball, a conditioning ball. I use these in my bar above classes to help us engage smaller muscle groups. So this or the yoga block is totally fine. If you don't have one of these, you can also get them like in the toy section of any major store. They're just that right kind of kickball-y size, nice and easy, just a kid's toy. The second thing that we will need is either a small resistance band or a yoga strap. Again, whichever you have handy is totally fine. These small resistance bands are also something I use a lot in my bar above classes. They're really great for body weight exercises, but adding a little extra oomph. Or if you've got a yoga strap or even a long scarf or belt or a beach towel rolled up nice and long would do the trick also. Today, for our video purposes, I'm going to be using our ball and our band because they're a little easier to manipulate more quickly. But to get us started, we are going to come down to our spines and find a bridge pose. So we're going to bring tail to the earth, come on all the way down to our backs. Keep your knees bent, your feet on the floor just about hip distance apart, with all 10 of your toes pointing away from your tush. And from here, you might notice there's a little bit of a natural curve in our lumbar spine as we lay on the mat, and that's okay. But we're going to get started just a little bit with some pelvic tilts. So think about your pubic bone or your tailbone, curling it up towards your belly, trying to flatten that space on the earth. And then taking your pubic bone or your tailbone towards the floor, away from your body. So we're lengthening our front and lifting up a bit at our lumbar spine. We're just going to take that nice easy tilt back and forth just to sort of warm up that lumbar spine, warm up our abdominals. Now I tend to have a good amount of that SI joint dysfunction. I have since my pregnancy, and even into postpartum. It hasn't really readjusted back where I'd like it to be. So I know for myself, I can feel that little pinch of that joint and that nerve, even just doing this. And you might be in the same boat as me. So if that's the case, know that you're not alone. We're going to take 3 more of these tilts. Last one. Good. And we're going to come back almost into that crunch position with our pubic bone drawing up towards our ribs, flattening that space of our lumbar spine, engaging those low abdominals. And I want you to spread your 10 toes wide on the mat. Press into the 3 corners of your feet, and as you do so, lift your hips into a bridge. So we want to make sure our knees stay coming out of a straight line of our hips. They're not falling open. Now we're pushing into our big toe mound, our little toe mound, and our heel. And that we're using that force to lift up with hamstrings and glutes and calves. So our back is nice and long. The back of our neck is long on the mat, and our nose points straight up to the ceiling. And we're going to see if we can hold it here for 5 big breaths. So find your big inhale and exhale. We got 4 more. Two, 3 more. And 2. And 1. And slowly, we're going to keep that little bitty tuck in our pelvis to roll our spine down. So their tailbone is the last thing to touch the mat. And when we get here, we'll take some windshield wipers with our knees. Just gently right and left. Again, releasing that low back, giving it a little breather, a little love, maybe a little massage into those glutes. And we're going to come back to center. And we're going to take a half lift. So before we were at maximum capacity on that lift, this time we're just going to come halfway up. We're going to inhale halfway up, exhale lower. A few more just like that. Inhale up and down. Keep it going. Halfway and lower, halfway and lower. We're going to take 4 more. 3, 2, 1. Good. Now coming all the way up. Full resistance, full stretch to the top of that bridge. Up and down, smooth and steady. So we're not letting our body rush to either direction, but we're maintaining control and strength as we move up and down in that bridge for 3 more rounds. 2, 1. Good. Bringing it down. We are going to take that ball or that block, and I want you to bring it right between your thighs. Keeping our hips and our pelvis on the mat. Just squeeze that block and our ball as tight as you can, like you were trying to pop it. And we're going to hold that squeeze, hold that compression. See if we can hold it tight for 5 big breaths. Ready? Engage those inner thighs. You're going to feel that draw all the way up into your pelvic floor. You might even feel some abdominal strengthening. Two more breaths. One more. Good. And maintaining a little bit of strength. We're just going to take baby pulses on that ball or that block. So strength and release. Think about moving a centimeter in and a centimeter out. Belly is strong. Pubis is still tilted to your ribs. So we've got a nice long flat spine on the mat. Good. Press into the big toe mound of your foot. And use your toes to help steady you. We're going to take 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Now we're going to keep hold of this ball, squeeze it nice and tight, and we're going to lift up into our bridge. And again, squeeze the ball, squeeze your booty, lift your hip bone straight to the ceiling. See if you can hold it here for 5 big breaths. 3 more. Last one. Good. Keep your hips lifted and find those pulses on your ball or your block. Again, a centimeter in, a centimeter out, like you were trying to pop it or smush it flat. If you need to drop your hips down, if this is too much, I totally understand. You can just take that exact same set we already did with our tushes on the mat. But for a little more power, a little more strength, we're going to keep them lifted for 15, 10, 5, 4, 3, 2, 1. Good. Slowly lower yourself down. We're going to release that ball or that block and take those windshield wipers just right and left. Good. Release that low back. Now you know we're not done yet because we haven't used our band yet. But I bet you can guess what's coming. So when you're ready, we're going to take that band. We're going to bring it over our legs just to about the midpoint of our thigh. And again, we're going to find our bridge pose. Toes forward, knees up, and I want you to press against the edges of that band. So if you were using your yoga strap, you'd buckle it and you would tighten it just about to the width of your hips or the width of your shoulders. And then you would push against that strap. Now what I don't want is for you to only push with your upper body or upper leg so that those knees spread way wider than your hips. Think about your whole leg as one unit. And imagine you were trying to rip your mat in half with your feet like it were a piece of newspaper. So we're pulling the outside edges of our feet away from each other. And at the same time, we're opening and spreading through that pelvic girdle. So see if we can hold it wide for 3 big breaths. One more. Good. The feet stay strong. Plant into that pinky toe edge. And take those little pulses out against your band or against your strap. Again, a centimeter out, a centimeter in. You might notice that your pubic bone naturally starts to tip back towards the floor. So we get a little more curve in that low back, and that's okay. But see if you can keep your belly button strong, drawn up and back to your heart and to your spine. Keep those feet engaged and feel that action happen all the way from your waistline, through your pelvic joints, to your knees, to your ankles, to your toes. We're going to keep that pulse going for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Find that just edge of resistance with our legs nice and still. Push into our feet and our toes to lift our booty into that bridge pose. And then again, imagine you're ripping your mat straight down the center seam, just with the soles of your feet, with that pressure of them isometrically drawing away from each other. So with the work with the ball, we were focusing on those adductors, those inner thigh muscles. And now the work with the band, we're engaging and focusing on those abductors, those outer thigh muscles. And those two sets of muscles are going to help us stabilize and support all through our sacrum and through our pelvis, through our hips, our low back, and low belly. We're going to see if we can hold it here for 3 more big breaths. 2 more. Last one. And then we'll find those baby pulses moving out a centimeter and in a centimeter. Again, you have that option. Drop your hips back down to the mat if this is too much. But if you've got the power and the strength today, if you're really feeling it, keep that tushy high for just a little more resistance and a little more work. Awesome. We're going to take 20. 15. 10. 5, 4, 3, 2, 1, and slowly lower those hips down. Good. Gently peel that strap or band away. Give yourself a big hug. Draw your knees into your chest and let yourself have a little rock and roll right and left like an egg. We're going to give ourselves a nice good glute stretch after all of that work by coming into a reclined pigeon. So feet are going to come back to the earth. Our right ankle is going to cross left knee, and we'll open that right knee nice and wide so you make a triangle between your thighs. You can stay right here, or you can thread through. Interlace your fingers behind your left thigh, or even on top of your left shin, whatever feels good for you. Whatever amount of a stretch is appropriate. And again, like I said, if you do have that little bit of nerve pain or that little bit of joint misalignment on one side, that side is going to feel this stretch super intensely. So for me, it is on my right side, which is where we're hitting it right now. So it is pretty intense in that glute. And if it's too much, feel free to back away. The further that knee is from your armpit, the less intense this stretch is going to be. We also want to do our best to keep head, neck, and shoulders on the floor. So if you need to grab a block or a blanket and put it under your head as a little pillow and help bring the earth to you, you are welcome to do that. And we're going to take 3 more big breaths on this side. One more. And we're gently going to release our hands, release our legs, and take our opposite side. So left ankle crosses right knee and opens wide. You can stay where you are, or if you want a little more, find fingers behind your thigh or on top of your shin. Think about flexing this top foot, making a nice full foot so you can wave your toes at me. And that's just going to help protect our knee in this rotated space. And again, notice what feels different from your left and right side. If one feels a little more or a little less accessible, or maybe you feel the stretch in a slightly different spot. Maybe one side feels more or less intense. And that's all totally normal and totally fine. We're very rarely symmetrical, especially when we're dealing with that SI joint and that sciatic nerve. It normally affects one side more than the other. We're going to give ourselves 5 big breaths right here. Two more. Good. We'll gently release and unwind. From here, we're going to send all 10 of our toes to the ceiling. And just point and flex those toes a couple times. Maybe take some ankle circles. You might hear my ankles snap, crackle, popping. And switch directions. And then we'll hug our knees into our chest. Give yourself another great big squeeze. And then slowly roll to one side and push up into your seat. So, I hope that gives you a little bit of relief in that low spine and in your glutes. As with anything, doing this one time isn't going to fix your problem. It is something that we need to continue to practice and to continue to work on to strengthen those muscle groups to help support our pelvis and our sacrum. I cannot wait to hear how you're feeling and what you're thinking after these few little drills and tips and tricks to help alleviate that SI and sciatic pain. Please, please, please feel free to message me or comment. Let me know how you felt before and after. Divine light in me loves and honors the divine light in you. Namaste.